A dire warning from Ontario nurses: lock down the province's COVID red zones or prepare for a very grim and very painful winter. The head of the Registered Nurses Association is calling on the Premier to pull the trigger on targeted wide-scale closures that she says will save lives and livelihoods.
If we don't suffocate the virus, COVID-19 doesn't take any breaks, doesn't sleep even, doesn't take weekends off. It will suffocate us.
Dr. Doris Grinspoon says our healthcare system is on the verge of collapse. As of today, Ontario is 25 ICU beds away from canceling surgeries, and she says we are facing a shortage of doctors and ICU nurses. She's calling for a targeted approach, locking down Ontario's COVID hotspots, Toronto, Hamilton, Peel, Halton, and York regions immediately for at least 28 days. This would exclude schools, at least for now.
So if there is no lockdown, paint that picture.
Grim. We predicted that if we don't take these serious measures, in February we will have a province-wide lockdown because otherwise the entire system will collapse.
Dr. Grinspoon tells me she's relayed this message to the Premier in a face-to-face meeting 1 week ago. Advice she says is falling on deaf ears.
I said to him, we need to move now because RNO is not going to continue to wait. This is a tragedy of mega proportions.
Today, Premier Doug Ford told reporters he will not hesitate to lock things down, but did not have a straight answer when pressed about what would have to happen for the hammer to drop.
I look at the health and safety over anything else.
Since COVID numbers began to spike in September, it's been a revolving door of changing rules and restrictions for businesses. Kristen Jeffries is a co-owner of Skull House Rowing in Toronto. She recently made the tough decision to shut down and go online until the new year.
Is it easier to survive with a hard shutdown, knowing that things can maybe get under control and you can probably open up to a more certain scenario where you can almost have your full business back, or this like painful roller coaster ride?
It would be easier to survive if we had a more definite shutdown that was, across numerous industries, that helped us see our numbers get back under control so that when we did open, we could open with fewer restrictions and we could open with more certainty and with people feeling more comfortable about being able to open.
Now, Dr. Grinspoon says the economy will not recover until COVID spread is under control, and that she has been talking to the province about the need for targeted lockdowns since the number of cases started rising again in September.